Welcome back to Studio Chatter. Mammograms. Some women find it uncomfortable, some think they don't apply to them, yet others are afraid of the results. Let's talk this through with Kelly Ruiz, the coordinator of imaging services at the Spanish Fork Hospital. Welcome to the table.
Thank you.
Hello, Kelly.
Hello.
So you have a big job over there.
I do, yeah. I'm over all of imaging. I have a manager over me, and then it's me, so.
Okay, so you're there. If we come to Spanish Fork Hospital, you're the one we're going to see if we're having mammograms.
Yeah, it'll be either me or Stacy or Ashley. We have three of us that do mammograms over there.
All right, so let's talk mammograms.
Yeah.
Okay,
so are we open 5 days a week?
We are open 5 days a week
Okay.
for mammograms.
Okay.
We start, our earliest is at 8 o'clock in the morning, and our last one is at 5:30 at night. So
Okay.
we're there from 8 to 6.
And we kind of know this because we've all had one, but walk us through like kind of start to finish, like how that process looks and how much time it typically takes.
Usually takes about 20 minutes. You'll come in and you'll register at the front desk, and then you'll be sent down to imaging services where your mammographer will come out to greet you, and you'll change in a dressing room, and then you'll get a nice warm robe because we have warm robes.
That sounds nice.
Yes.
It's like a spa.
Yes, a spa robe, and then we'll go through the mammogram. We'll go through some questions on an iPad that we ask that kind of about your history and your genetic history, and then we'll do your mammogram, and that's it. Easy as can be.
So about scheduling,
Yes.
one of the things, I know that we've talked about, or we're talking about some of the things that women probably put it off, like they don't want to do the mammogram. One thing that I've always been intrigued about, and I know this is super weird, but you can't wear any deodorant, you can't wear any perfume. So I always schedule mine early in the morning. So I'm like, I don't want to go. I want to smell nice, but I don't want to be, affect
I like
the
clean and then let's go.
right. So why? Like, why does that affect the image?
So deodorants or lotions can actually have aluminum in them that can show up like little specks, like calcifications.
Okay.
So we don't like to have that because we don't want to have a false positive or a false negative or whatever we would call that. We don't want you to get called back in because you were wearing deodorant.
And is that the same for like the regular mammograms and the 3D?
Yeah.
Or what's the difference between the
So
two?
the 2D is, we use the same machine for both. The
Okay.
2D just gives us a 2D image. The 3D actually does slices through your breast. So like, it's almost like having a CAT scan of your breast. You're gonna get lots of slices through your breast. So it allows the radiologist to get through dense tissue to see anything that might be underlying the dense tissue that sometimes overlaps. And then he can see like how far back it is, how deep it is. So it's pretty cool.
Do you just decide if it's 2D or 3D? Does the doctor decide that?
A lot of times it's the patient and your insurance. Most insurances pay for 3D now. It used to be, when it was first coming out, it wasn't. It was kind of like you had to hope that your insurance paid for it. Now, most of the time, your insurance does pay for it. I would especially if you have Select Health, they always pay for it. Most all of them do. But if you're questioning that, I would call your insurance before you come, because the 3D really is the 2D is still the standard of care, but a 3D gets you, especially if you have dense breasts, it's a much better exam.
I just feel like then it should be for everyone, right?
So that's a good question too, because one of the other questions you get asked, do you have implants?
Yes.
And that's a completely different way to screen the breast, right?
Yes. So we do. With someone with implants, it's going to get 8 pictures instead of 4, basically. And the reason for that is we're going to do pictures with your implant in place.
Okay.
And then most of the implants are behind your pectoral muscle, so we're going to push those back and get just the tissue. And it's really amazing to see the difference between when you have the implant in place and you can't see very much tissue to when you push it back and you get a really good picture of that tissue. So implants can obscure that, so that's why we do those pushback views, so we can see the breast tissue better.
Can someone just call and make an appointment with you, or
Yes.
do they have to have a doctor referral?
No. So if it's a screening mammogram, you don't need an order. It's one of the only things you can ever.
You can just do once a year.
Once a
and you don't
year,
need a doctor
usually
referral.
within that 12 months. We always try to keep people right on about the same. If you go longer, that's okay.
That's
but
okay,
if you
but not
sometimes if
sooner.
you come sooner, your insurance will question it. So once a year. If it's a screening, which just means that you don't have any symptoms, you're asymptomatic, then you're going to come in for a screening mammogram, and that doesn't need an order.
Okay.
And so what's the difference between that and a diagnostic? Is diagnostic like we think that we have it,
Yeah.
or
It's diagnostic is if you feel a lump or if your doctor feels a lump, or if you have any other strange symptoms like discharge that's a certain color or anything like that, then your doctor would recommend a diagnostic, which the difference between that is you have those symptoms and you're going to go to like Utah Valley or somewhere for that because they have a radiologist there, right? So you have the imaging done and the radiologist is right there to like say, hey, let's try this or let's get an ultrasound or whatever. And so usually you walk out knowing your results if it's a diagnostic.
Oh, really?
Yeah.
Okay.
So a screening is just what most of us do. We don't have any issues. We're just going to go in and get screened, and then you'll get your results from your doctor within about 5 to 7 working days on those.
And say you did have an abnormal screening, then
Yeah.
what happens then?
So there's a breast care coordinator at Utah Valley, and they will call you up. If the radiologist wants you to come back in, they'll call you up and set up an appointment for you to follow up at Utah Valley where there's a radiologist. And they sometimes will do spot compression film, sometimes it's a ultrasound, whatever it is that they think that they need. And they'll set up an appointment for you to do that, and then you should know your results right after that too, because there'll be a radiologist there.
So do they usually call your doctor or just you, or
they'll call your
both?
doctor.
Okay.
Well, they'll call you. If
Okay.
they'll call your doctor if they need to get because once it becomes a diagnostic, at that point you need an order. So they will
Okay.
get a hold of your doctor to get an order for that.
Okay.
But they will call you and set that appointment up directly with you.
Okay.
So I've been called back for an ultrasound before.
Yeah.
So I questioned this also. I'm like, why don't they just always do an ultrasound? What is the difference? Is it the picture? What are you trying to see differently?
So an ultrasound isn't very diagnostic on its own because
Okay.
lots of women have cysts and so if they were to go look at it and without a mammogram first, they're just going to be looking at your breast going, oh yeah, there's something there, and you know what I mean? Like it's just all dense tissue. So once they have a spot that they know they're going to look at and they know where it is, it's
Okay.
easier for the ultrasonographer to go right to that spot and show the radiologist what that is.
Interesting.
Yeah.
Okay.
Yeah.
So
Been there.
when I started getting mammograms, they said every year.
Yes.
Now they're saying every 2 to 3 years. I talked to my friends, how often are you being told? Everyone's like from a year to 3 years.
Yeah. So
What-
most all the publications, the professional societies, and the health organizations have decided that it's starting at 40 and it should be yearly. Your insurance pays for it yearly, so I always tell people if your insurance pays for it, why not have it done? Because for me, it's a safety net. Like I had it this year, there was nothing. If I have it next year and they find something, I know I've caught it early, right?
Yes.
So if you're having it every year, if you go every 2 to 3 years and then they find something, you might go, well, how long has it been there?
Well,
and I'm
I
now.
wanna
And how
Sure.
fast is it growing?
Right.
We don't know.
I would like to share a quick personal story of
Sure.
a very close friend. She goes the first week of August every year.
Yeah.
Even though she was told, every 3 years. And she went in this year, 6 weeks later, so 2 weeks ago, double mastectomy.
Yes. Yeah.
And last year, it was totally fine.
Yep.
So she texted us all and said, please get in and get your mammograms. Because I'm like, if they're like 1 to 3 years, I'll do like
Yeah.
a year and a half, 2 years. But
Yeah.
after that, I'm like,
No.
that's too big of a risk. And,
Right.
and they can catch it and take care of it.
Yeah. I mean, mammograms are the best screening tool we have. And if we catch it early and we treat it early, survival rates are high. So it's something that we should be doing as women just because we want to catch things early and not have to go through a lot of that stuff. So
Okay, thank you.
Getting our nails done, getting our pedicures, and getting our
your mammogram,
mammograms.
yes.
And size doesn't matter, right?
No.
Big, small, in between,
Yep.
it just needs to be done.
Yes.
Okay.
And a lot of women will complain or they think it's going to be painful. And you'll feel compression. It's going to be a little tight. But if you feel pinching or anything like that, we can readjust that. And I have a lot of women that come in for their first time and they're like they're so nervous because they've heard such bad things about it. And then they leave going, that was easy. That wasn't hard at all.
Right.
I'm like, yeah, there's a lot worse things than having a mammogram. I can tell you
Right.
that.
And the cancer
Right.
part of it
Yeah.
would be that.
Right.
Yeah.
Yep. Well,
Super important.
Here, I have a question
Yes.
here. Should there be a concern about radiation doses?
So with the 3D and with the technology that we have nowadays, we are using a pretty low dose of radiation to get a pretty high quality image.
Okay.
So
Don't be worried.
the risk outweigh the,
Okay.
I I don't think people realize that they get radiation pretty much every day of their life, right?
No,
so,
I did not know that.
Yeah.
Use it to
on your cell phone, right? Yes.
Cell phone and microwave.
We get high quality for low dose, and
Don't worry about that.
don't worry about it.
okay?
It's more important. Just getting your annual mammogram every year is not going to be a radiation dose that is harmful to you. No.
All right. Thanks so much.
You're welcome.
Thank you.
Thank you so much.
Coming up next, how is technology helping in the battle with breast cancer? Stay with us to find out.